Hello and welcome. I'm Fernando, a GP in the UK. Today, we're looking at the NICE updates published in September 2023, focusing on what is relevant in primary care only. So let's jump into it. The first clinical area is an update on COPD because some of the quality standards have changed. And the first one says that we have to refer patients with COPD to a pulmonary rehabilitation program if they have a score of 3 or above on the Medical Research Council or MRC dyspnea scale. And this is because pulmonary rehabilitation improves exercise capacity, quality of life, and levels of anxiety and depression. And let's remember what a score of 3 or above means on the MRC dyspnea scale. Grade 3 is defined as walks slower than contemporaries on level ground because of breathlessness, or has to stop for breath when walking at on pace. Grade 4 is defined as stops for breath after walking about 100 meters or after a few minutes on level ground. And Grade 5 is defined as too breathless to leave the house or breathless when dressing or undressing. NICE also specifies that pulmonary rehabilitation will be at least 6 weeks in duration and include a minimum of twice weekly supervised sessions of structured training. The second quality standard change refers to patients being discharged from hospital after an acute COPD exacerbation. We will be able to expect these patients to receive a care bundle before discharge, which means that before they leave hospital, they will have a good understanding of the medication and inhaler use, a self-management plan, a smoking cessation intervention, a referral to pulmonary rehabilitation if appropriate, and a follow-up within 72 hours from discharge. The second clinical area refers to the use of semaglutide for managing overweight and obesity. The update in September 2023 is not a clinical one, but it refers to the company's commercial arrangement that makes semaglutide available to the NHS with a discount. But let's quickly review the recommendations for semaglutide for managing overweight and obesity. Semaglutide is recommended with a low-calorie diet in adults only if it is used for a maximum of 2 years with specialist input, and they have at least one weight-related comorbidity and a BMI of 35 or more, or a BMI between 30 and 35 and meets other referral criteria, for example, failure of conventional treatment or when we're considering surgery. We will use lower BMI thresholds, usually reduced by 2.5, for people from non-white family backgrounds. This is because they have an equivalent risk from obesity at a lower BMI than people from a white ethnic family background. And we will consider stopping semaglutide if less than 5% of the initial weight has been lost after 6 months of treatment. We have come to the end of this episode. Remember that this is not medical advice, and it is only my summary and my interpretation of the guidelines. You must always use your clinical judgment. Thank you for watching, and goodbye.